Welcome to The Explainer. We're jumping right in today because we're taking an exclusive behind the scenes look at the strict, layered protocols healthcare workers use every single day to stop infections dead in their tracks. We're talking about the absolute masterclass in infection prevention precautions. So, if you've ever wondered exactly how medical professionals manage to build this invisible fortress around themselves and their patients, well, you're in the right place. Just think about this for a second. How do nurses and doctors actually survive the daily invisible crossfire of infectious diseases? I mean, they are literally surrounded by some of the most contagious and dangerous bugs known to humanity, day in and day out. And yet, they stay perfectly safe. It's definitely not luck, and it's for sure not magic. It all comes down to a meticulously designed system of biological defenses. Okay, here's our roadmap for today. We're going to hit breaking the infection chain, standard precautions, stopping contact and droplet spread, defeating airborne threats, and we'll wrap it all up with special rules and combinations. Starting with part 1, breaking the infection chain. Look, infections, they aren't magic, right? They're a biological chain of events, and just like a physical chain, if you snap even one link, the whole thing falls apart. There are 6 specific links here. You've got the infectious agent, the reservoir where it lives, the portal of exit, the mode of transmission, the portal of entry into a new host, and finally the susceptible hosts themselves. The massive takeaway here is that every single link has a very specific medical intervention. You eliminate reservoirs by cleaning equipment, you block that portal of exit by covering coughs, and you stop transmission by using the correct infection prevention precautions. But get this. If you want to know the absolute most powerful move you can make to protect a susceptible host, it's hand hygiene. Seriously. Hand hygiene is the single most effective way to prevent infection transmission and break the chain before and after every single client contact. It is your #1 weapon, bar none. Moving on to part 2, standard precautions, our baseline defense. So now that we know how the chain works, our first actual layer of defense is this universal baseline, and it's applied to absolutely everyone in a healthcare setting. Standard precautions are the bare minimum infection prevention practices we use for all client care, completely regardless of their infection status. Now, in contrast to that, transmission-based precautions are escalated measures for specific known bugs. But here's the crucial thing to remember. Transmission-based precautions are always used in addition to standard precautions, never instead of them. You're basically taking specialized armor and stacking it right on top of your standard baseline armor. So what exactly triggers standard precautions? Well, if you anticipate contact with blood, you wear gloves. Every single time. It also covers all body fluids, non-intact skin like cuts or rashes, and mucous membranes. But wait, here is a massive hallmark exception that trips up so many people. Sweat is not covered. Sweat is literally the one and only body fluid excluded from the list of standard precautions. Pretty wild, right? All right, part 3, stopping contact and droplet spread. As we escalate our defenses and start layering on that extra armor for pathogens that require us to be, a bit more strategic, our first stop is contact precautions. These are for defending against the touchers, bugs that spread through direct contact with the client or indirect contact with contaminated surfaces. For this, you need a gown and gloves on entry to the room. We're talking about really sticky infections here, like MRSA, RSV, C. diff, and scabies. And remember, the environment matters just as much as the patient, because these organisms can survive right there on the surfaces. Okay, pause here, because there is a critical safety trap you absolutely have to burn into your memory. When you're dealing with C. diff, which causes severe infectious diarrhea, alcohol-based hand rubs absolutely fail. They do 0 against C. diff spores. That means you must use actual soap and water every single time you perform hand hygiene, and that room has to be cleaned with bleach. Alcohol simply won't cut it. Now, when we talk about isolating these patients, private rooms are always preferred. But what if you're completely out of private rooms? That's when you use the cohorting rule. Same bug, same room. You can only put 2 patients together if they have the exact same organism. 2 different contact infections. Never share a room. You absolutely cannot put a MRSA patient in the same room as a C. diff patient, or, well, you've just given them both a second infection. Moving from touch to the air, we have droplet precautions. Honestly, this one is just physics. We're talking about large respiratory droplets from coughing or sneezing. Because they're heavy, they only travel up to about 3 feet before gravity pulls them down to surfaces. They are not suspended in the air. So because of that, your primary defense is just a standard surgical mask when you're within that 3-foot drop zone. You do not need a heavy-duty N95 mask for droplet precautions. Which brings us to part 4, defeating airborne threats, our highest isolation level. Now, what about the bugs that actually defy gravity? This is our highest routine level of isolation. Unlike those heavy droplets, airborne pathogens are tiny. They're microscopic particles that remain suspended in the air and travel way beyond 3 feet. They can literally be inhaled deep into your lungs. Because they float around like this, physical distance isn't enough. You need specialized air handling. This means the healthcare worker has to wear a fit-tested N95 respirator, and the patient must be placed in a negative pressure room with HEPA filtration and the door firmly closed. A regular surgical mask? Totally insufficient for staff here. To keep track of which diseases require this intense level of isolation, I've got a fantastic memory trick for you. My chicken has TB. It instantly groups the 4 main disease categories that need airborne rooms. M is for measles, chicken for chickenpox or varicella, HAS for herpes zoster, specifically disseminated shingles, and TB for tuberculosis. If it's not one of those 4 groups, you're generally looking at contact or droplet. Finally, part 5, special rules and combinations. Because, the real world doesn't always fit neatly into single boxes, and sometimes diseases combine their attack vectors. So what do you do when an infection needs more than one precaution category? Simple. You apply all of them. Take varicella, or chickenpox. It spreads through the air, but also through contact with the lesions. So you need airborne and contact precautions. Or COVID-19, which often requires contact, airborne, and eye protection. You just combine the PPE until you've built a full impermeable suit of armor tailored to every single way that specific bug can attack. Let's synthesize all of this. We've built this layer by layer into one master key for infection control. You've got standard precautions for everyone, then contact precautions demanding gowns and gloves for sticky bugs like MRSA, droplet precautions needing a surgical mask within 3 feet, and airborne precautions requiring an N95 and negative pressure for floaters like TB. This layered approach, that is exactly how you build total defense. Before we wrap this up, let's rapid fire through an insider's safety checklist just to really cement these concepts. To break the chain, hand hygiene is always priority number 1. If a procedure is invasive, you must use sterile technique. If you see C. diff, your brain should immediately scream soap, water, and bleach. For airborne diseases, you need that N95, negative pressure, and the door closed. And a huge pro tip for when you're doffing or taking off your PPE, the mask always comes off last. Remember, it's protecting your respiratory tract. Which leads us to the golden rule driving every single hospital protocol on Earth. Safety first, hand hygiene always, and the most protective answer wins. By understanding these layered infection prevention precautions, you now know exactly how medical professionals keep the invisible world at bay. So I'll leave you with this to ponder. Now that you know the invisible chain of infection is literally everywhere, how differently are you going to look at a simple door handle or a crowded elevator tomorrow? Thank you so much for joining me in this explainer. Stay safe out there, and I'll catch you next time.